Welcome to Module 3 of the United Nations University Institute for Water, Environment and Health course on water and health, targeting linkages and gaps for impact. In this module, we focus on enhancing development outcomes by spotlighting key initiatives and lenses which addresses linkages and gaps in the water and health sectors. As we covered in modules 1 and 2, having universal water, sanitation, and hygiene is critical for good health and well-being. Unfortunately, access to universal wash is a pipe dream at the current rate of progress. Achieving this will require a 6-fold increase in current rates of progress for safe drinking water, 5-fold increase in sanitation, and 3-fold increase in hygiene. To spur action, the United Nations promotes partnership and cooperation to accelerate impact across sectors. UNWEH, a network of multilateral and international NGOs with water programming, highlights 5 processes to help accelerate SDG 6 progress, emphasizing that data and information and financing must be applied to build capacity, innovate, and govern water resources. But this is just one way that we can achieve greater impact. This module reflects on enhancing development outcomes through integrated water and health programming and applying intersectional lenses. A very significant and successful global water and health collaboration focuses on improving the quality of drinking water for the ultimate purpose of improving physical health outcomes. In 1958, the first international drinking water standards covering microbiological and chemical parameters were established. One of the major strategies that helped make sure that standards were met was the release of drinking water quality guidelines by the World Health Organization. These guidelines importantly introduced health-based targets or baselines for drinking water quality globally. In 1984, the WHO disseminated the first comprehensive guidelines covering microbiological, chemical, and physical parameters. Over time, the WHO has updated its drinking water quality guidelines to reflect advances in scientifically robust knowledge, changes in water quality management practices, and emerging concerns related to public health. For instance, in 2004, the WHO introduced its flagship risk assessment methodology to recognize the importance of mitigating rather than just responding to risks, called water safety plans. We will cover this in more detail in the next slide. It is important to note that the latest edition addresses emerging contaminants of concern, such as pharmaceuticals, micro and nanoplastics. While the 2017 edition addresses some emerging contaminants of concern, this is still an area that requires a significant amount of research, including advances in technology to detect emerging threats. Since 2004, the WHO has published guidelines to prevent drinking water-related health risks through adequate water safety planning. Water safety plans are proactive and systematic implementation strategies for ensuring safe quality drinking water throughout the supply chain, from source to tap or from catchment to consumer. through health risk planning and management. Over the past 2 decades, water safety plans have been widely adopted and implemented by water utilities and wash service providers due to the comprehensive management of risk through a system assessment, operational monitoring, and management and documentation based on the experiences and lessons learned in low, middle, and high-income country context. It is important to note that the latest edition, published in 2023, of Water Safety Plans integrates climate resilience and equity considerations into water safety planning's step-by-step risk management approach. One should also note that WSP supports universal safe water access despite growing uncertainties from a changing climate. To complement water safety plans, the WHO published a risk-based planning and management tool for sanitation systems in 2022, named Sanitation Safety Plans, or SSP, to further safeguard public health. Sanitation safety plans are systematic planning and management strategies for risks throughout the sanitation chain. By sanitation chain, we mean from toilets and containment for storage to conveyance for treatment and later end use or disposal. Sanitation safety plans addresses risk through 6 basic steps. Modules 1 to 3 focusing on the planning aspects, in which we prepare and conduct system assessment to identify and mitigate hazards, assess existing control measures and exposure to risk from catchments to consumers. Modules 4 to 6 focusing on management aspects. This guides management and investments according to health risks through development of an incremental improvement plan, monitoring of operations, and developing supporting programs like regulatory oversight mechanisms for highest risks, and finally reviewing the plans. Sanitation safety plans complement the guidelines on sanitation and health that WHO released in 2018, based on 3 high-profile trials and systematic analysis of over 1,000 studies on various sanitation-associated health outcomes, from infectious diseases to nutrition outcomes. One key takeaway message of this review was that the influential F diagram informing WASH programming for decades needed to be more comprehensive. WHO thus unpacked sanitation hazards across the sanitation chain, from toilet use to disposal, and how people could be exposed to fecal contaminants from animals and contaminated water, including water bodies and groundwater, to highlight various sanitation-related environmental risks. These guidelines, coupled with the WHO's aforementioned sanitation safety planning guidance, importantly highlight the value of maximizing health benefits from sanitation through comprehensive risk planning. On neglected tropical diseases, the WHO collaborated with partners to release the 2nd edition of the WASH and Health Working Together, a how-to guide for managing NTDs programs. This guide utilizes the BEST framework, which focuses on preventing and mitigating the harm of NTDs by targeting behaviors, environment, social inclusion, and treatment and care. Behavior science is therefore a central approach in this guide. Behavior science is the process of modifying behavior, often to end certain behaviors considered bad, adapt or form new ones considered good, and maintain good behaviors over time by targeting drivers and barriers to change. This handy guide breaks down how the BEST framework can be applied to various NTDs, and it importantly highlights in blue where WASH centrally features in prevention, treatment, or care. In recognition of the fact that health systems are vulnerable to climate change and they too need to be environmentally sustainable, the World Health Organization released guidance in 2020 to support healthcare facilities to withstand threats of a changing climate and various environmental factors such as water, sanitation, and air pollution impacts. The guidelines include a 5-step process to adapt the systems, from advocating for change through greater political commitment and community engagement to assembling and training multi-sectoral teams that can support climate resilient and environmentally sustainable healthcare facilities over time. In terms of multi-sectoral teams, a key purpose of the guidelines is to ensure that the health workforce is informed, empowered, and skilled to respond to climate and environmental challenges through adequate resourcing, capacity development, and greater communications. To complement the Climate Resilient and Environmentally Sustainable Healthcare Facilities Guide, WHO and UNICEF established the WASH in Healthcare Facilities Initiative with a global roadmap and guidelines to ensure safe WASH is integrated into health programming. The lack of universal safe WASH in healthcare facilities critically impacts the health of the wider population and the safety and well-being of healthcare workers on the front line of delivery. Guidance is therefore provided, including information on how to conduct a baseline assessment and checklist for long-term operation and maintenance, for securing water, sanitation, and hygiene services, and broader environmental, sanitation, and safety needs by addressing healthcare waste, environmental cleaning, and electricity services. Metrics for success include situational analysis, standards, and, importantly, integrating WASH in health planning, budgets, and implementation. Addressing this key gap in WASH and health service delivery is a key gap that can be addressed for impact. While we have so far covered 7 key areas of water and health guidance from WHO and partners, we also want to cover innovative research that is changing how we surveil diseases and measure water security. One major advancement in water and health research from the global COVID-19 pandemic was the rapid advent of wastewater epidemiology or surveillance as a useful early warning system for disease monitoring. Wastewater contains key information on pathogen spread, its evolution, and outbreak risk at the community level. You may want to ask, why is this useful? Clinical surveillance generally requires that people be tested for diseases, which can be impacted by health-seeking behaviors and costs. Additionally, as observed during the COVID-19 pandemic, clinical testing capacity was overburdened and unable to meet demand at the peak of the crisis. So, wastewater surveillance, when coupled with clinical surveillance as a complementary tool, allowed health authorities globally to detect viruses shed in wastewater and estimate disease prevalence that ultimately informed public health strategies. Since the pandemic, wastewater surveillance has been used to monitor influenza and monkeypox outbreaks, and there's potential to apply to other diseases of concern, such as neglected tropical diseases. However, knowledge and resource gaps are important to overcome, as research needs to be conducted to investigate in sewage, environmental, and laboratory factors that can influence data analysis. Another innovative research initiative focuses on measuring water insecurity based on lived experiences. One of the key problems with the water sector is that the standard metrics we use do not capture the quality of services. For instance, a tap and toilet provided would count if they were broken. In light of this, a consortium of researchers called the Household Water Insecurity Experiences, or HWISE, developed a cross-culturally validated tool to measure water access and use from the user's perspective. The Simple 12 Question tool interrogates household water insecurity by asking whether anyone in the household had experienced thirst, if they had to change their behaviors and plans, or what they ate because their water supplies were interrupted or were not usable or drinkable. The questionnaire also asked about worry, anger, or shame linked to household water problems. Implemented in 50 countries by over 100 organizations and simple to administer at 1 to 3 minutes per surveyee, the findings from the household level survey have significantly shown how water insecurity impacts economic resources and nutrition, including both physical and psychosocial health of adults and children. Development of independent measurement skills is critical to ensure that WASH interventions result in anticipated health outcomes, and further research is needed to develop tools that measure sanitation and hygiene insecurity at multiple scales. While we have covered 9 great interdisciplinary water and health initiatives, there is still so much scope to continue to improve so we can reach more people, especially those in marginalized or overlooked populations. This is still a key gap in practice. We therefore want to close this course by highlighting the intersectional and intentional lenses that should be the backbone of all actions to ensure that no one is left behind and that development is both equitable and sustainable. What we learned from water and sanitation safety planning, the BEST framework for neglected tropical diseases, and WASH in healthcare facilities programming is that All actions should be comprehensively planned through human-centered approaches, in the sense that they should be designed for humans who need, use, and manage water and health services for greater inclusivity. Additionally, the neglected tropical diseases toolkit and HWISE skills demonstrate the value of unpacking water security from multiple perspectives to build resilience by challenging conventional framing and methods to rethink water solutions based on specific behavioral and health needs. We especially need to do this to tackle water-related mental health issues that require a holistic approach. Research on gender-based violence highlights the need to mainstream gender, equity, and inclusion measures to improve the lives and security of women and girls across the globe. Last but not the least, each action demonstrates the value of working across disciplines and sectors by applying a transdisciplinary lens. Through partnerships and collaborations, we will develop integrated water and health interventions towards a healthier people and planet. Before we close, let's recap what we've learned from this Water Learning Center course on water and health, targeting linkages and gaps for impact. In Module 1, we discussed the Sustainable Development Goals, especially SDG 6 on water and sanitation. Unfortunately, we are significantly off track at current rates of progress. To accelerate progress, it is important to seize opportunities such as aligning water programming with the health sector to increase impact. In Module 2, we discussed critical linkages between water and health programming, addressing infectious diseases, chemical contaminants, and well-being risks. In Module 2, we additionally discussed how emerging pressures such as climate change significantly impact interventions, hence the need to address such threats in both policy and practice. In Module 3, we spotlighted 8 promising interdisciplinary water and health initiatives and reflected on how such partnerships allow for greater impact. Going forward, we close with the need to apply intentional cross-cutting and intersectional lenses to redress current water and health gaps. Thank you for joining us in this course. We also appreciate the Canadian government for supporting UNU-INWEH's open access capacity building and strengthening opportunities through Global Affairs Canada.